Welcome to all of you who have joined us for our Lunch with the League program today and for this panel discussion. I'm Ann Havlick, co-president of the League of Women Voters of San Luis Obispo County. This is the second of our expert panel discussions about the humanitarian crisis in our own backyard, homelessness. This is a topic that our membership voted on as a priority to address. To better understand this issue, we began with educating ourselves and our community so that we can move forward with advocacy and action. Our first expert panel was an overview of homelessness in San Luis Obispo County. And today's expert panel concerns who has experienced homelessness in San Luis Obispo County. We welcome our expert panel for today's discussion. Our panelists are Brandy Graham, Veteran Support Program Manager, SLO, which is Community Action Partnership for San Luis Obispo. Brandy has been working with SLO's Veteran Support Program since 2015. She began as a case manager in the supportive services for veteran families, and she took over as the program manager in 2017. In 2019, SLO Veteran Support Programs Division was able to secure funding through the Department of Labor for additional veteran-specific program named Vets SLO 2. We'd also like to welcome Mark Lamore, Director of Homeless Services, Transitions Mental Health Association. Mark is currently the Division Director of Homeless Services at Transitions Mental Health Association, which includes 65 Now and HUD Permanent Support Housing Programs, Homeless Outreach Program, Full Support Partnership Program, as well as the PATH and HDAP programs. Mark has been employed with Transitions Mental Health Association for 13 years. And prior to Transition Mental Health Association, he was self-employed for 25 years as the owner-manager of a vocational rehabilitation counseling firm. And we have Jim Roberts, CEO of the Family Care Network. Jim is the CEO and founder of Family Care Network, Inc., and has worked in the human service arena for over 42 years. Prior to establishing Family Care Network, Jim worked for 15 years in probation, including 10 years as a camp administrator, chief deputy, and chief probation officer. He has not only been the visionary and the leader of Family Care Network, but has served as a key leader in developing a number of programs and initiatives in the San Luis Obispo County, including the Children's Services Network, the Regionalized Integrated System of Care, Therapeutic Foster Care, and Wraparound Services, Transition Housing Programs and Services, and the Mental Health Services Act program. For over 3 decades, Jim has engaged in advocacy and public policy development at the state and federal levels. This included the development of significant legislation, public policy, statewide program design, rate setting, and litigation settlement. This virtual meeting will be moderated by Marlis McPherson, League member and former Morro Bay City Council person, and has been a member of the Countywide Homeless Services Oversight Council for the past 4 years. So Marlis, would you like to take over as our moderator?
Thank you very much, Ann, and it's a pleasure to be here today. As you mentioned, what we're going to talk about is not only who the homeless are, but some of the reasons why they became homeless. We will conduct the session like we did the initial webinar that we held in December. I will pose discussion questions to the panelists who will have the opportunity to respond in turn, and we will leave time at the end for audience questions. The webinar is scheduled to end at 1, but our panelists have agreed to stay a bit longer if we still have questions remaining. For folks in the audience, please use the Q&A button to enter your question at any time during the webinar. We will collect them and ask the panelists to respond following the discussion. But first, I would like to take about 5 or 10 minutes to provide a snapshot of the characteristics of our homeless population from the last point in time count, which is conducted by the county's Department of Social Services. So Glenn will be sharing his screen with some summary slides while I describe the point in time information. So Glenn, you can go ahead and share. And just to let you folks know, this is the best information available on who and how many people are homeless. It's conducted every 2 years in communities across the country and required by the U.S. Department of Housing and Urban Development of all agencies that receive federal continuum of care funding. There are 2 parts to the point in time survey, which was last conducted in 2019 by a professional survey research organization. First, there's a count during a 4-hour time period, which is early in the morning, 6 to 10 a.m., of unsheltered homeless individuals and families sleeping outdoors in encampments, on the streets, in parks, tents, or vehicles. At the same time, the number of homeless individuals and families residing in emergency shelters or transitional housing facilities was counted. A specialized count of unaccompanied children and transition age youth under 25 was conducted on the same day later in the afternoon. The second part of the survey is an in-depth survey that's administered to a random sample of 418 sheltered and unsheltered individuals and families. As I mentioned, the last survey was conducted in 2018, late January, and that is the data that I'm going to report to you now. There are plans to go ahead with the 2021 point in survey this month, towards the very end of the month, and those results should be available in March or April. I should tell you that the survey is not necessarily an accurate count of the number of homeless. If anything, it probably undercounts the actual number. But it's conducted on a regular basis using the same procedures, so it allows for time comparisons to see if homelessness is increasing or decreasing, and across jurisdictions to see where the problem is more serious. So what does the 2019 count tell us about who is experiencing homelessness? First, the 2019 count identified 1,483 homeless individuals in SLO County, which was a 32% increase over the previous 2017 count. And most important, the vast majority, 79% or 1,172, were unsheltered, living in conditions unsuited for human habitation. Of the unsheltered, the majority were sleeping on the street, in their cars, vans or RVs, or in encampments. And only 311 people were in shelters or transitional housing facilities. The majority of the homeless, 68%, were male and the remaining female. The next set of data comes from the survey portion of the study. As I said, there was a random sample of 418 sheltered and unsheltered individuals. The large majority of the homeless, 79%, were adults over 25, but yet 10% were children under 18, and another 11% were young adults between the ages of 18 and 25. Just over half of the survey respondents reported that they had been homeless for 12 months or more. Nearly 3/4, actually 74%, reported that they were living in San Luis Obispo County at the time they became homeless. In other words, these are not transients. These are people who live here and lived here before they became homeless. 14% had been in the foster care system, and 37% had spent 1 or more nights in jail, prison, or juvenile hall in the past year. When asked what the primary cause of their being homeless was, 30% said they lost their job, 20% attributed it to alcohol or drug abuse, 17% were evicted, 11% said it was due to divorce, separation, or family breakup, and the remainder said an argument or family or friend asked them to leave, and 8% cited family or domestic abuse. And I might note that they could have responded with multiple reasons, but you can see a pattern beginning to emerge. Fully 88% of the homeless survey respondents reported that they were unemployed, and of those, half indicated they were unable to work for some reason. When asked what prevented them from obtaining permanent housing, the most common responses, as you might predict, suggest insufficient funds. 66% said they couldn't afford the rent, followed by lack of job or income, 35%, no money for moving costs, 21%, bad credit, 16%, and no transportation, 14%. The top health conditions survey respondents reported experiencing in 2019 were drug or alcohol abuse, 36%, psychiatric or emotional conditions, 31%, post-traumatic stress disorder, 26%, chronic health problems, 23%, physical disability, 21%, traumatic brain injury, 8%, and AIDS, HIV. And again, they could have given multiple responses. The federal government identifies 4 subpopulations with particular challenges or needs. They include chronic homelessness among people with disabilities. That was 20% of the respondents. And disabilities here includes abuse issues, mental health issues, physical disabilities, chronic health problems. Veterans, there were just under 10% in the survey population. Families, including children, just under 15%, and youth and young adults between the ages of 18 and 25, 12% of the survey population. So as you can see, our 3 panelists are especially qualified to talk about these subpopulations and the challenges they face. So I'd like to begin by having each of you tell us about your organization, the number of people you serve, and what the typical reasons are that your clients became homeless. And can I start with you, Mark?
Sure. Thank you for inviting me, and look forward to talking to your group. I am employed with Transitions Mental Health Association, and I am the Division Director of the Homeless Services, which comprises of a homeless outreach team, and also we have a permanent supportive housing component. The homeless outreach team is contracted to outreach to over 300 homeless individuals in the county per year, with the goal of trying to bridge them to services depending on what their particular needs are. The supported housing programs are 2 components. One is the 65 Now, which is charged with responsibility of working with some of our more challenged homeless community members. These are individuals who are suffering from the trimorbidity, which is a substance abuse, physical disability, and mental disability. We have a modified ACT team, which consists of a registered nurse. We have a therapist, drug and alcohol counselor, peer support counselors, and all of those individuals serve as case managers. The HUD, or the Housing and Urban Development funded program, provides supporting services to clients who are chronically homeless and also have a disability which is expected to last longer than a year. And that disability could be a mental disability or a physical disability. Typically, the clients that we serve are chronically homeless. They average in length of homelessness from 5 to 10 years. They have a multitude of medical, mental health issues. The average age is about 50 to 59 years old. So these are individuals that have been on the streets for a long time. They're dealing with a number of challenges, and bringing them into housing is the first step. Our programs are what's called Housing First model, which the old model used to be, well, go get some treatment for your mental illness, go get into a recovery program, and then we'll talk about housing. And that model has turned to the Housing First model, where we find that providing housing is the first step, and securing that housing, getting people safe off the streets, and then we'll start working with the individual issues that they're experiencing. We provide case management support. We come up with what's called service plans and goals, and each individual is individual depending on what their needs are.
And what is the source of the housing that you're providing? Where are you providing the housing?
We have housing units. When I first started, we had 7 units and 31 clients. Currently, we have over 45 units and are serving 125 clients, range from Oceano to San Miguel. We have arrangements with private landlords. We work with a number of private landlords who make their units affordable. We also have a very good working relation with the Housing Authority of San Luis Obispo, and we sublet units from them. They also provide us, for the 65 now, they also provide us with Section 8 vouchers. We're allotted up to 60 Section 8 vouchers, which does make housing very affordable for clients who are currently on SSI or SSDI.
And is that a typical caseload for your organization?
Yes, we are at capacity right now. We're always looking to expand, but currently we are at capacity.
All right. Thank you. Brandy, can you tell us about the Veterans Services Program that you're responsible for?
Yes, we are. CAPSLO is one of 2 grantees here in San Luis Obispo County that provide the supportive services for veteran families grant. We are also a rapid rehousing and homelessness prevention program specifically for veterans and their families. Much like the TEMA programs, we are also housing first, where we're looking at the first step is getting somebody into housing, taking them out of crisis, and then looking to connect them to different resources within the community in order to stabilize that household and promote self-sufficiency. We are targeted to serve about 106 households a year, and last year exceeded that by a handful, and are on target to probably exceed that again this year as well, making best use of our funds. Our program is set up and provides a number of services, first being outreach, of doing street outreach into encampments and to local providers. We have a case management staff that works with our participants coming in, of creating a plan of how they're going to maintain that housing once our assistance runs out. We also have staff members that are designated to help find housing. We don't have units that we have on hand. We have to compete with the open market for our veterans to acquire housing. So we have 2 housing navigators to actually assist with that process with our veteran participants as well. We have a benefits acquisition specialist that helps with filing for SSI, SSDI, getting the mainstream resources that they may qualify for while they're getting on their feet through Department of Social Services as well. And we also have our newest kind of cog in the wheel is the healthcare navigator. So what the VA noticed is that through multiple surveys and looking at this is that there were a lot of individuals that we were serving that have significant health complications that need some assistance in navigating those healthcare systems, need some advocacy and some support. And so we actually have somebody on staff in all of our SSVF programs too, as well as having a healthcare navigator and somebody that's helping them navigate that healthcare system, helping them make appointments, arranging for them to get to those appointments, and even offer assistance in going to those appointments, advocating for them and asking those questions to the doctors that they've shared with them. So in addition to those, we also provide the financial assistance. We are a short-term crisis intervention. So our range of assistance is anywhere from 6 to 9 months of financial assistance to get this process going.
Okay, and the veterans, are they from all wars, or is there a specific age or war that they are veterans of?
There are all wars. I would say what we have seen is we've seen a significant increase in the number of our aging veterans. So Vietnam era and Korean War era, our aging population is where we're seeing a pretty dramatic increase, about a 5-fold increase from 2019 to 2020.
Okay, and you mentioned that your goal is to get them into housing, and again, you have people looking for housing. Typically, what kind of housing are you finding for them?
A majority of our households are single adult males, quite honestly. So looking for studios and one-bedroom apartments tend to be the most common request for our individuals. We also look at room share situations, or I'm sorry, house sharing situations where they're renting a room, but generally they're single occupancy units.
Okay, and you're providing them with the financial assistance to
Yes,
keep them there. Okay, all right. All right, thank you, Brandy. Jim, you're up next. You want to tell us about the Family Care Network?
Absolutely, and I appreciate what the League is doing, putting on these forums. They're really important. Homelessness is something that we all deal with, I mean, most of us hopefully are all sheltered, but we experience and encounter people all the time. For me, having, as you heard, my background working in probation for many years, I was very frustrated with the fact is that youth in the system, whether they be in the juvenile justice or child welfare system, were pretty much, when they turned 18 or advanced out of the system, were just kind of pushed out on their own. And historically, former foster youth, 60 to 70% of them ended up homeless. And so part of the impetus for me creating the Family Care Network was to try to deal with this one particular issue. Right now, Family Care Network, we provide 20 different programs, 5 of which are transitional housing. But I started with, working with children aging out of the foster care system. And so we actually have 3 different programs that focus on foster or former foster youth. And fortunately, the laws have changed over time. I've done a lot of advocacy at both the state and federal level to make sure that we're able to support these kids to get out on their own successfully. We serve foster youth 16 and 17 to give them the skills to be able to leave the system and have some, living arrangement that's healthy and successful. And we work with foster youth that are 18 to 21. The law changed, the federal law changed back in, I think, 2010, that allowed the states to choose to work with that population. And then we work with former foster youth as well. So we basically are serving transitional age youth from ages 16 to 24, and we provide transitional housing, but more importantly, we provide a lot of intensive skill building and development, relationship building. We work on getting these youth the career on a career path and to move them more successfully towards a future, and not just serving them momentarily and then sending them out to fail. That's not our model. We have served a number of these youth, probably close to 1,500 in our transitional housing programs. We average probably 80 to 100 youth a year in that program. And then we moved back maybe about 10 years ago into the housing support program, which is basically working with our partners at the social services to work with homeless families through their CalWorks program. And generally, these are families that are in acute homelessness, a lost job, underemployment, substance-related issues usually underlies a lot of it, but they're families that are homeless. And very often, when we get them referred, they're maybe living in a vehicle, they're living in an RV, camping out, or whatever. But our job is then to find them housing, temporary housing, help them to prepare to move into permanent housing, and then also do some skill development, career development work with this population as well. We served about 1,200 of these families over the past years. We average around 2 40 to 50 families a year in that program. And then the last program that we just added a few years ago was called Bringing Families Home. And basically, the foster care system, unfortunately, has a number of children that are lingering in foster care because their parents are homeless. And it may not be that they're bad parents, or there's an issue with putting them back. There's just no home for them. So it's now our responsibility to work with those families to find them, housing, and again, the supports and the services, the skill building, whatever it takes to help them not only to secure the housing, but to keep it and hopefully then transition into a permanent housing. We work probably at any given time, are 60 to 70 of those clients, per year in our Bringing Families Home program. So we see a lot of homelessness over a broad continuum that we work with. And again, our thrust is to take and transition them towards permanency with finding the housing that they need, to find the skills, to learn the skills, to the financial assistance or whatever it takes, to get out there on their own successfully. Our success rates have been pretty darn good, right around 80 to 85, some higher percent success rate with all of our programs since we've started doing our transitional age housing back in 1999, 2000, whatever it was.
I'm glad you mentioned success rates, Jim, and maybe we'll ask our other panelists if they have information about the success rates for their programs. Brandy, do you keep that kind of information, and do you know what your success rate is?
Nationwide, the SSVF program collects all of that data, and nationwide, our supportive services for veteran families providers have an 84% success rate of individuals remaining housed for at least a year after their exit.
Okay. And Mark, how about you?
Well, in our housing programs, the 65 now, one of the items we track is the percentage of individuals that remain in housing for over a year. And we are at about 75%, which in looking at the clients that we're asked to provide services to is just remarkable that we're able to, provide the support and the services they need. The permanent supportive housing program is a little higher than that, although we're not, I don't know if we're going to get into talking about the vulnerability index and the coordinated entry program, but how we select clients for the various programs depends on their vulnerability and the length of homelessness and the natures of their disability. So the 65 now, as I mentioned earlier, we're taking the top of that list and working with those individuals, with the idea being that if they do not get off the streets, they do not get support services, a large number of them could pass away. They're that vulnerable.
Well, I was going to ask a follow-up question about how many of your clients fall into the category of chronically homeless, but you've also raised this issue of vulnerability. So perhaps the panelists could address both the issue of chronic homelessness as well as the vulnerability of the clients that you serve. Jim, do you want to take that?
Sure. Actually, I think that for us, vulnerability is high with our transitional age youth because very often they're engaged in risky behaviors. And so again, as an early intervention, it's probably because they are such a vulnerable, high risk, at risk, group. And, the statistics that I won't bore you with, but are pretty alarming about this group. If they go out and unserved, post foster care, it's not a pretty picture. In terms of chronic homelessness, so we're trying to prevent it with our transitional age youth. What we're finding with our the housing support program and Bringing Families home is that they're really not yet experiencing chronic homelessness. Most of them are acute cases where it's more immediate because of fiscal or other health, substance abuse situations, but they're still a family. And so again, our service is really designed to be an interventionist, one to prevent the long-term homelessness. I mean, that's really, we're a treatment organization, and so that's why, you know, those programs are designed to do.
Right. And Brandy, I don't think we asked you that question about the.
No, for our participants at intake, we are averaging right around 67% are chronic, are homeless, and those that are chronically homeless are looking at, I'm looking at my Excel spreadsheet here, 27. So about 50% of them are chronically homeless.
Okay. All right. All right, and Mark, did you want to say anything more about the vulnerability index, which you raised that issue?
Sure, and also regarding the chronic homelessness in our particular housing programs, 100% of our clients have to meet the HUD definition of chronic homelessness, which there's about 4 or 5 different layers, but basically that means a person has experienced over 12 months of homelessness in the last 3 years. The vulnerability index is what's called a VI-SPDAT, and that's a vulnerability index, service prioritization, determination, and assessment tool is what it means. And a number of our community partners meet with their clients, and they will conduct that survey. And there's a series of questions that are asked pertaining to medical health, mental health, length of homelessness. They have some very tricky ways of trying to not be too intrusive, but are you being forced to do things that you wouldn't normally do? Do people take money from you? This type of thing to determine just what's going on in this person's life. And then those areas are added up and a person receives a score, and it's a combination of homelessness and how they answered those questions. And you know, the scores can range from, I think the highest we've had is about 60. The average tends to be around 10 to 20 when you combine those scores. So, and it's arbitrary. If you ask someone on the street some of these questions, you may not get as truthful answer. We find that as you become, as the client develops more trust with the case managers, you get a clearer picture. A lot of times people think, well, if I lie about my substance abuse or don't talk about, you know, I don't have a mental illness, that their chances of getting housing would be higher, when actually it's just the opposite. You know, the more truthful they are and able to reveal what's really going on in their life gives them a better chance of scoring higher on that test.
Okay. It sounds like you all work together in some capacity. So how do the services that you provide kind of vary by the reason that somebody becomes homeless? So how are your services different from other service providers? And we can start with Brandy.
The biggest determining factor for our population is that it's veteran specific. So any individuals that may come into the various programs or shelters within the community, if they're identified as being a veteran, which the HMIS database does ask specifically if they're a veteran, then those individuals get referred over to our program directly from whoever the provider is that they inquired on services, because our services are veteran specific.
Okay, but then you're capable of providing the range of help that they would need if they're a veteran.
Yeah, and we provide the case management, very similar outreach, and financial assistance, very similar to the other community providers. I think where we differ really is we have somebody designated on staff that assists with connecting individuals to benefits and helping them file SSI and SSDI applications and getting mainstream resources. We also have the healthcare navigator to help them engage in healthcare services, which is new and more specific to our veteran program. And then really the last point of this is that we're familiar with all the veteran specific resources as well, and are able to connect them to those specific resources that are geared towards veterans themselves. So.
Okay, thank you. And Jim, obviously you're focused on young people, youth at risk. Are you able to provide the range of services for the particular clientele that you serve?
Yes, I mean, one distinction with all of the clients that we serve is that the referrals all come through the county, either the Department of Social Services, the probation department, and in some cases through county mental health. But, and so with our transitional age youth, we can provide a very full range, a large palette of services. We do the case management. All of my staff that do that are, trained in behavioral supports and services. We're also a certified behavioral health clinic, and so all of our social work staff are licensed clinicians, and so we provide a whole array of mental health services as well to those clients. And then we also are the independent living provider for the county, so we have a lot of ancillary services that we can, provide to these young people in terms of career paths, career development, and mentoring, education navigators, etc. With our housing support and bringing families home, we utilize kind of the same level of case management services for those folks. We will broker and get them connected to behavioral health, mental health services, substance abuse services if needed, and we could be the provider. Again, that would just depend on what circumstances are, but I think you can describe all of our programs as being fairly intensive intervention services, and we do a lot of, like with our housing, our family programs, we do a lot of classes, we do a lot of group work. I mean, COVID has kind of changed it a little bit, but thank goodness for Zoom. But at any rate, yes, I think that's what kind of carves us out, is that really is a treatment housing prevention program.
Okay, and Mark, it sounds like you are serving people of all ages and with a range of problems, but go ahead and tell us how your program is distinctive, or what services you are different that you provide that others don't.
Well, I think there's an overlap with a lot of our programs, but Transitions Mental Health has a wide variety of services that our clients are able to tap into while they're in the program. Like I mentioned earlier, when someone comes into our program, we do individual service plans and goals, and obviously establishing a stable housing is one of our first goals. But we have clients that have educational goals. We have clients that have vocational goals. We have a team that has supported employment program. It works closely with the Department of Rehabilitation. So if someone is interested in returning to work, they can go through an assessment to determine, what their physical and mental capacities are in order to return to work, and in what capacity. One of the areas that really impacts is the families. We have some client who's having mental health challenges. It really does impact the family and the family members. So TIMA has a family support program that works with family members who have loved ones who have mental health challenges, to help them navigate through the system. The system can be a quagmire of which door do you go through to get services, and these these are navigators and counselors that have been through the system and can help the family navigate that. We also have a youth program, and we have an adult transitional program for individuals who their independent living skills are not at the level where they can fully be on their own. So we have a 24-hour program where we have staff on call, or actually present 24/7 to provide assistance when needed. We do have navigators and outreach workers that go out into the community to engage individuals, try to connect them to services. Bishop Street was one of our large projects that we just completed. That's a program where they're housing, I believe it's 33 individuals who are open to behavioral health program. We also have our community housing program. And then within my division, we can provide assistance with obtaining Social Security benefits, be it SSI, SSDI. We have an advocate that can meet with the clients and start that process, which can be a very difficult and long process, procuring all the medical records necessary to present a solid case to the Social Security Review Board for determination of eligibility of benefits. So, and those are just a few of the services we provide within the housing programs themselves. We have weekly house meetings. We have case managers that are meeting with the clients individually. You know, I joke sometimes, I've been married 43 years, and there are days my wife can't be under the same roof with me, and we're asking 3 and 4 individuals to come together with multiple challenges and to coexist in a congregate setting. And with the Housing First model, you're bringing people in right off the street. So you can imagine the challenges, and I'm just amazed at how well our clients do and the staff do to overcome some of those challenges and be able to live harmoniously in a setting like that with some of the challenges they face. So it's really beautiful to watch that. And when you bring I used to think when you bring somebody in off the street and provide housing, great, my job's done. Well, we're learning that, you know, it's just starting at that point. You know, individuals coming in off the streets that have been homeless for 10 years, you know, having to conform. We do ask them to contribute to their rent, that we ask them to pay 30% of their income, whatever that is. If it's 0, then they pay nothing. If it's SSI, which is typically $943 a month, their rent is $273 a month. So it makes it very affordable. And as I mentioned earlier, we have a good partnership with the Housing Authority of San Luis Obispo. So as our clients are able to move into independent housing, we are able to procure Section 8 vouchers, which then the client only has to pay 30% of their income, which makes housing very affordable in this county, because this is one of the most expensive counties in California to live in. So
Right.
that really is a real asset to our clients being successful.
Okay. Well, you brought up the issue of money, and I'm going to ask you next to tell us how your agency is funded and whether or not you're able to serve all of the people who need and want your services, or do you actually have to turn people away due to lack of your own resources? So Jim, we'll start with you.
Okay. Yes, our funding is interesting. Every one of our programs has a different, you know, funding stream. Our transitional age youth programs are based off of rates that are either set by the state or set locally by the County Board of Supervisors, and they're, you know, they were pretty much, the state rates are not capitated in terms of the numbers that we can serve. The capitation that we experience is on the housing availability. Our Bringing Families Home and the housing support programs, those do have contract capitation so that we can only serve so many clients per year. And once we hit that, there's potential for a waiting list. What we found over time, particularly with our transitional age youth, is that the rates don't cover our cost. And so we have done a substantial amount of the community donor development. We've had a few beneficiaries that have really taken on the transitional age youth population, so that we've been able to have a steady stream of ancillary funding to help us to go above and beyond what our rate structure can actually cover. But the biggest really impedance to us right now is the lack of housing. As is mentioned, this is a very expensive area to live in, and we're fortunate that we've been able to purchase 9 different housing apartment complexes to be able to serve most of our kids. That we've got a lot of landlords that we work with very closely, to provide us with units. I mean, that the county's been very generous that way, but there's obviously a housing shortage, and that's so for instance, we get a referral for one of our family programs, and it will most likely take us 3 to 6 months to find housing. We'll be able to provide services during that time, but they're going unsheltered, for that a good 3 to 6 months until we're able to secure a housing unit for them.
Okay. Brandy, how about you?
Our supportive service for Veteran Family Program is funded through the Department of Veteran Affairs. And as far as having enough funding to serve everybody that comes to our doors, I believe that we've done a really good job and are able to. On the flip side of that, we have a lot of regulations as well. So we do still have to turn people away. And that, I think, is the most disheartening for especially my staff, who are mostly veterans themselves as well. We have regulations that our targeted population that we serve is extremely low income and very low income. So they cannot exceed 50% of the area median income. And as we all know, we do live in one of the most expensive places in California. And that has been a challenge for our veterans that are seeking services, is that they may be over that 50%, what we refer to as AMI, area median income, but are really still struggling and feel that they don't have the resources in order to survive. So that is one of the biggest challenges. And then the other challenge, especially with our location, is that we have several installations that are specific to the National Guard and to the reserves as well. Here locally, 3 of them specifically, either in our county or at the border of our county. And one of our regulations is that to be considered a veteran that we can serve through our program, they have to, if they were in the reserves or National Guard, they had to have been put on federal orders and been deployed, and that's not always the case for reservists and our Guard.
Okay, thank you, Brandy. And Mark, how about you?
Our funding is from several different sources. Our full service partnership, homeless outreach programs are funded through Mental Health Service Act funds and through county behavioral health. Our permanent supportive housing through the HUD program, Housing and Urban Development, obviously is funded through grants that we renew every year through Housing and Urban Development. And so far those have continued without reduction, happy to say. And then the 65 Now, we have when it comes to homelessness, we have a pretty proactive board of supervisors. And back in 2014, they provided funding to house 50 of the most chronically homeless individuals in the county. And then every year after that, they increased it by 10. And then early last year, we were anticipating going up to the 80 Now program, and then COVID hit, and of course, obviously, there's financial concerns. So we backed that down to 65 now, just so it would stay sustainable financially until we kind of sort out what's going to happen with COVID and tax bases. To answer your question on can we serve everybody that wants housing? Absolutely not. The vulnerability list or the coordinated entry list, there's several hundred people on that list that are looking for various levels of housing. So we have to defer people to that list. We have to, as openings come available, then, you know, we can house individuals. But do we need more? Absolutely. I think it takes about $10,000 to $12,000 a year to provide supportive housing for an individual. So, and then one of the things we were asked to do with the 65 Now was to track the number of services an individual used 12 months prior to coming into the program and 12 months after. This would be ER visits, hospitalizations, jail days, and days in the psychiatric inpatient unit. And almost across the board, what we've shown is that we've reduced those numbers by 70 to 80%. In case of jail, almost 90%. So trying to make the connection of the money saved, you know, it was, I was very proud of our Board of Supervisors to go ahead and authorize that and to take that leap of faith that it would work. And, you know, it does save the county and the taxpayers money when you know, factor in the savings in those various areas.
Right. Well, I was going to ask a question about if you had an estimate on the proportion of people in the groups that you serve who are unsheltered. And it sounds to me like you've all sort of answered the question that there's actually not enough housing available. So there is a significant proportion of the population that you are serving that remains unsheltered because there's no housing available. So I want to thank you for all of the responses you've given us, and you've given us a lot to think about. I'd like to go and move to the audience questions, and let's see what the questions we have here. Here's a question. How long are you typically able to cover the housing costs for each of those placements while you work on a plan to help them stay? And who wants to start with that one?
Well, in my world, our units are permanent supportive housing. So we will provide the housing for as long as the person needs those services and obviously meet the eligibility requirements. So we've had, like the 65 Now, we've had individual, we started the program in 2014, and we have about 25 people that have been in there for the full almost 6 years now.
Okay. And Jim, how long are you typically able to cover the housing costs for the placements until?
Well, with our, yeah, let me kind of give you a bit of a view of that. On our transitional age youth services, a youth can actually, you know, start in one program and migrate to another and then to another, so that conceivably they could get supportive transitional housing for, you know, 4 to 6 years. That's unusual. The average is we will have young people that may be with us a year and a half to 2 years. A year is not uncommon. You know, many of our transitional age youth will leave to go into a career path. But, you know, when we're talking about an 85% success rate, that means they're leaving us to some permanent housing situation. In our housing support and bringing families home program, again, these are transitional, all of our transitional, but we're able to do, you know, some rent support and assistance. But generally, you know, the 6 to 9 months, we're going to want to see them starting to transition towards permanency. And I have to say, you know, working with the housing authority as our partners, my peers here, has been wonderful getting those Section 8 vouchers when they're available, and to be able to move people, you know, into more permanent housing. And so we've had, you know, some of our families in the housing support and bringing families home that maybe have received services for, you know, 1 to 2 years, but that's unusual. Generally, you know, we have a really good case plan to move them to permanency as soon as possible, but never to just, you know, cut them off and say, oops, here you go, we're back out on the street. That doesn't happen.
Yep. And Brandy, what about you?
We're a short-term crisis intervention. So depending on the amount of their income when they come in, for our very low income individuals, we're able to pay for 6 months of rental assistance and a security deposit. And then the extremely low income can receive up to 9 months of rental assistance along with their security deposit.
Okay, so there's set requirements.
There are set requirements depending on their income, but our individuals are not in a transitional situation. We are seeking permanent housing, so they are going into a permanent housing from the beginning.
Okay, well, here is a question about transitional housing. What constitutes transitional housing? Do they not fit the standard of permanent housing? If transitional housing is less expensive and more available, could they be used as permanent housing, at least for certain clients?
I can address that initially. When I first started at HEMA, we had a transitional housing program, and it was great. Transitional housing usually means that there's an end date. Typically, it's 24 months. And the program that we administered, the person would come in, we would work on those independent living skills, and at the end, the Housing Authority would provide a Section 8 voucher that they could graduate into their own independent permanent housing. Unfortunately, nationally, this was not a successful program, at least through the HUD program, because I think a lot of counties did not have the relationship with the housing authorities that we have. So what we were pretty much required, if we wanted to keep the funding, to convert those transitional housing beds to permanent housing, which we have done. So it's great, the clients have a permanent place, but also we've kind of lost that flow from the beginning to the end to the graduation, because with permanent housing means that that person can stay there for as long as they feel it's necessary. So, there was mixed feelings about that. And I know Jim's got some transitional programs that it sounds like it kind of works through, where you have a beginning, a middle, and end. And that flow is nice to be able to work people through the system.
It is. And so, but all of our programs by design are transitional. The official name of our youth programs are the Transitional Housing Placement Program. And there's 3 licensing structures that are all identified as transitional, as well as the Bringing Families Home and the Housing Support Program. They're all designed by statute to be transitional. And so, my biggest frustration is I would love to have the resources to have our own permanent housing, because that's the last step that's missing, where TEMA has been able to really capture that, which is an awesome thing. But the biggest challenge that we have, I think, is that, you go through the transition, you give them the skills, and then finding them that permanent housing, it can be a real challenge. I give a big shout out to my staff. Have done a marvelous job over the last decade, plus, really finding, solutions, but it's not the best of solutions. We need, permanent housing that all of our clients can move into.
Okay. Here's a question, actually 2 questions about a program from Bakersfield called Virtual Zero Homeless, a chronic homeless housing program called Built for Zero. Would a program like this serve SLO? I don't know if anybody's familiar with that program, but if you are, could you make a comment?
The Built for Zero is actually a campaign, not necessarily a program, where their homeless service providers come together with a common goal and market that in order to house a certain number of people within a certain number of days. And Santa Barbara County also I think just wrapped up or is wrapping up with that, I think this month, where they had a set target of housing. I think it started off for 100 people in 100 days. But it is a campaign. It's a way to market that to the community. It's a way to get landlords on board. I think absolutely we could try something like that here in our county. Well, I think Jim and Mark are both in agreement, is that our biggest challenge really is acquiring housing for individuals transitioning out. And so I think that is why I think some places like Bakersfield also had a lot of success in that. That Built for Zero is the availability of housing, and their vacancy rates in some areas tend to be a little bit higher, and makes that a lot more of a successful campaign for them.
Yeah, and I will say in deference to San Luis, is that we have a really good housing coalition. We have really good working relationships. I mean, you know, seeing my peers here, I can just tell the community, we all work hard together. We come up with solutions, you know, whether it be, you know, referring, cross-referring, working through the housing authority, through the coalition, and trying to pull in funds, you know, for us locally. The Bakersfield program is, I think it's effective, it's good, but we've got, you know, one of the lowest vacancy rates in the United States. Theirs isn't, and that complicates things as well.
Well, interestingly enough, there's a question here about if you folks would like to comment on the gap between minimum income for housing support and the high cost of living in San Luis Obispo County. Anybody want to comment?
It's big.
Well, I think we've touched on a little bit already. We bridge that gap by using Section 8 vouchers. There's mainstream vouchers. You know, our clients that have very low income obviously could not afford housing in this county were it not for a Section 8 voucher or some other type of housing support. Not all the clients in our HUD-funded program have Section 8 vouchers, and we're using grant money to help supplement their housing. So, you know, there's just a lot of, and there's some funds coming in. We were just in a meeting today, ESG funds, and, you know, there's you know, we've had No Place Like Home. Team has been able to procure some units through those grant funds, so we can actually own some private housing units. So we get together, all of us meet on a regular basis, and you know, take a look at what's available and how we can best use it. You know, there's really not a lot of competition between agencies in our community. We really sit down and what is the best fit for this particular grant, and then we move ahead with it to bridge those gaps.
But that issue is not only just, you know, pertinent to the homelessness issue. It's a workforce issue. I lose 25, 30% or more of my staff every year because they can't afford to live here. We hire a lot of Cal Poly students, first job, and then they can't afford to stay here, and because they can't afford the housing. So it's an issue that permeates our whole housing, you know, market here.
Right. And fortunately, we're going to have a panel discussion on housing. So hopefully we'll get into some of these solutions. Here's a very interesting question. How close could we get to zero homelessness in SLO County if funding was dramatically increased? Is that possible?
I think that funding is always an issue, but I think that the greater issue is the one that we were just talking about, is our housing vacancy and our housing availability. We just don't have enough housing to support moving all of these people necessarily into housing right now. I think that funding most definitely is always going to be a big piece of that, but that is because the high cost and the low vacancy rate in our area, that we're always going to have that challenge.
I'll echo what you just said. I think that, you know, we're fortunate that we have the infrastructure in place. We've got the services, we've got the outreach, we've got what it takes from that service delivery side, and to really reduce the number of folks that are living homeless. But we don't have alternatives for them to shelter in. And that's got to be, you know, and that is a funding issue. And I think that's the number one thing that we've got to address in this county to really reduce our homeless population.
I think also understanding that this is a slow process, and we make gradual progress on this as well. And I can share, so the veteran service providers that are specific, and there's several veteran specific service providers, have to keep a master list. And I know Mark is very familiar with the master list for COC, but we have one for our veterans. When we first started keeping this list, which was I think in 2015, there were over 350 veterans on that list. that were homeless seeking services in our county. And slowly, over the past 5 years, we have narrowed that down through diligent hard work, and have gotten to the point where we're at the generally between 40 and 65 people on that list. That's a huge amount of individuals that we've been able to move off that list and to connect with services and get housed. But that was gradual over time, us doing the work and creating those relationships with landlords, getting people housed, and really working with our other community service providers and looking at ways to get, for us, since we're a crisis intervention, of looking at ways to get people connected to long-term resources as well.
I think it's important, though, that we also realize that there's also a kind of a co-occurring issue along with housing, and that's affordable wages. There has people be able to get a living wage. We've got to be able to mitigate poverty of people that are underemployed, because that's another huge issue here. You know, there may be housing available, and we work with so many families that we're trying to move to permanency. Well, a big issue is to find a job that will pay them enough. And, you know, so I think that's got to be also something that our time and our attention and energy and money is directed at.
Okay, and here's one last question for you. What do you anticipate the impact will be on homelessness when the eviction order expires?
That's
I'm
something
afraid.
yeah. This has been a prevalent topic of discussion in our homeless services oversight council meetings, in our service committees. This is a big concern, not only just locally, but also at a national level within some of our programs. This question is being brought up, is that when our eviction moratoriums start ending, do we have the capacity to handle that influx, and how are we going to handle that capacity, right? Is it going to be assistance to just keep them in their unit, or is it going to clear that debt? What is that going to look like? So there are a lot of really important conversations happening right now, because we are anticipating, I think it's been referred to on some of our meetings as a tsunami of service requests for those eviction prevention funds.
Agreed. Well said.
Okay. Mark, do you want to say anything?
No, I agree completely. It's,
Okay.
I don't know what it's going to look like. You know, the clients that we're typically dealing with when they're homeless, I don't anticipate a big increase in those numbers. I think it's what Jim was talking about, the workforce and the people that are actually out there and, you know, eking by, and then now they've lost their jobs and potentially are going to lose their housing. And those are the ones that will be reaching out through the rapid rehousing funds and some of the money that's coming down through COVID to try to assist those individuals.
Okay, well, I'm going to read one last comment. This is one of our participants said, I just wanted to say that you guys are my heroes. So glad there are people like you in our community. Thank you so much for everything you do. And I want to echo that too. And thank all of the panelists for a very engaging discussion this afternoon. And I'm going to turn it over to Cindy Marie Adsey.
Actually, you're turning it over to me, Marlis.
Oh, okay. Sorry. Well, I'm turning it over to Ann Havlick, co-president.
I want to echo what you just said, and I want to thank the panelists for participating. It has been very enlightening and just a great addition to our expert panel series. And thank you, Marlis. Thank you so much for all your hard work, and your husband, Glenn. And this is just the second one in a panel that we are now in the planning stages of 3 more. Topics might be encampments, the role of first responders. The next one would be housing and homelessness. And the last one we're looking at is what can be done about homelessness and how can you help? What can you do? So I also want to do a shout out and a thank you to our program planning committee under the leadership of Deb Humphreys, and to Jordan Becerra, our chairperson for our communications committee, and her wonderful team, which includes Glenn and Dave Humphreys. And then I would like to say that if you this will be ending with a resource page, and we will also be having a survey that will come up at the end. And if you would please take a couple minutes to complete that for us, it would be so helpful. And again, thank you for sharing your time with us and your knowledge. And we're so grateful for your energy and your hard work. Thank you.